Hi, I'm Willie Dayan and welcome back to this quick tip series called Willie's Aligner Secrets. And these are small hints that you can use in your modifications and adjustments to aligner orthodontics for your patients. Let's get on with today's hint. Rotating bicuspids with horizontal attachments. Many times in our aligner orthodontic treatment, we might decide to change attachments or have different optimized attachments or different attachments for different movements. And sometimes we have competing concerns for our patients. So for example, we may have rotated bicuspids on a patient, and at the same time as the lower bicuspids are rotated, which we know that either vertical attachments or optimized rotation attachments might work very well. At the same time, we have a deep curve of spee and we want to level the curve of spee. So the question becomes, will the horizontal attachments still correct the rotated bicuspids? So you can see in this case, in the first set of aligners that were proposed, there were different optimized attachments, and these attachments might be very good at rotating or tipping the bicuspids into correct positions. But my concern was that the patient had a deep bite at the front of the mouth, and if I didn't have good horizontal grip and good leveling of the curve of spee, a topic of course for another time, I wasn't going to get the overbite corrected. So I changed the ClinCheck in many ways, but one of them is I change it to horizontal attachments on the bicuspids. Now you'll note that in the ClinCheck, even though I changed it to horizontal attachments on the bicuspids, and I did excess leveling of the curve of spee, etc., I did not take away the rotation correction of the bicuspids. So will the horizontal attachments be sufficient to rotate these bicuspids, and why? Well, let me first tell you the answer. Yes, the rotation attachments are sufficient to rotate the bicuspids, and if the patient is wearing the aligners well and the doctor has set up the ClinCheck properly, they're going to track and they're going to derotate. Now let's discover why. Well, think of the horizontal attachment as capable of retaining the aligner intimately with the tooth. So it provides retention of the aligner to the tooth, and as the tooth or the aligner is retained in the occlusal surface of the tooth, there are vertical walls in these occlusal pits that give the aligner a grip to turn the tooth. It is very much like when we turn a screw out of the table. We are not pulling the screwdriver away from the head of the screw, or let's call it for a minute the occlusal surface of the screw. We are staying engaged inside the vertical pits of the occlusal surface of that screw, and we're pushing downwards or retaining our screwdriver into the screw occlusal surface, so that as we turn the occlusal, or as we turn the screwdriver, the teeth of the screwdriver stay retained inside the occlusal surface and cause the tooth to turn, or cause the screw to turn. So it's the same way the aligner stays retained on the occlusal surface of the tooth and provides a rotation correction. Thank you for joining me for this 5-minute quick tip, or less than 5 minutes, but certainly do come to your ortho coach for your one-on-one case coaching, other quick tips, and on-demand webinars. See you online. Bye-bye.